So the 16th of January is traditionally Blue Monday, the day when people are at their lowest. I think it's got to do with serotonin levels and sunlight.
Also a great single by New Order.
So the Samaritans have named it this year Brew Monday, and we are fully supporting the Samaritans on that.
Really like that.
Sharing with others what you do to lift your mood. What do you do to lift your mood, Mark? Somebody that actually does suffer from depression.
I go for a run, I'll do something physical, but as we've been saying in all of these films, I think share honestly with someone who you know loves you is the best thing to do. And I do think it's about sharing honestly with someone you know loves you and you trust. What's the saying?
Those that mind don't matter, those that matter don't mind. And I wish one day you'd learn that, because it's a very good saying. But also, the great thing about the Samaritans is they are there for people that may have people close to them that love them that they don't want to share with, or might not at this point in their life have anybody, and the Samaritans are there 24/7. They're an incredible organisation, and they are there to help. And meanwhile, if you know somebody that's feeling a bit down, that's possibly feeling a bit low, just give them a call, invite them over a cuppa. Asking somebody how they feel and then really listening is
a huge gift.
It's a great gift.
It's a huge gift. And Blue Monday, I mean, it's funny, isn't it? It's funny that there's a day that they consider to be the most depressing.
It must be the lowest light.
Every day's depressing. I don't know. Is it the lowest light?
I don't know. Does anyone know?
So my advice would be, although it's Brew Monday, let's make it Brew Tuesday, Brew Wednesday, because you might feel all right tomorrow, and then you'd be terrible if you feel crap on Tuesday and you think, well, it's not Brew Monday. We've got to wait till next year. So, yeah. Great work the Samaritans are doing, and the great thing is you can phone them with any convergence of issues. It's like Maddie said to me the other day. She said, when are you shooting your depression, anxiety, addiction alcoholism
film? That's our daughter. We went from doing it every day because it was really, I think, a bit too taxing doing it every day, wasn't it?
It wasn't really just that, but there was just a fear that perhaps we'd end up sounding like a broken record.
When we left it last, you just had your medication upped, hadn't you?
Yeah.
Your citalopram.
Citalopram. Have you noticed any difference since Tuesday?
You're sleeping, which you weren't before, and I was wondering,
deeply.
Is that because the antidepressants also act on the anxiety as well, so you have less anxiety, so you sleep better? Or is it just a mallet effect where it's just knocking you out?
I feel like I'm waking from a coma.
When you wake up?
Yeah. But when the fog subsides, it's not necessarily, I don't feel necessarily as sort of overwhelmingly negative as I did before. But I do feel slightly muted. I do feel slightly sort of spaced out and a bit unaffected by things. A bit, I don't know whether that's just kind of getting used to it again.
I think you're a bit better.
Do you?
I think you feel more even.
Yeah.
But you're definitely driving me mad because you don't bloody listen to anything.
What do you mean?
You're constantly going, what?
Yeah, because I seem constantly distracted.
Have you not just heard anything I've just said to you?
Well, maybe as a drug it kind of helps to filter out the totally inconsequential. Just a thought.
Is that one of the?
It might be one of the very positive side effects. Positive side effects of CBT. That was one of the things we were going to talk about.
Yeah. For me, as the partner of, for all that you've done, all the different kinds of therapy that you've had, rehab, I didn't notice anything make such a marked difference as much as CBT has. And if I'm honest, it's the thing I find most frustrating about you. It really annoys me that you don't go once a month, once every 2 months.
I mean, it's partly
because
it's
I think
so
it makes a massive
difference.
Yeah, but it makes a massive difference. Yeah, but you don't drink.
No.
Do you? So what, you can't go to CBT once if you do find this? It's really frustrating with somebody, isn't it, when you know what will make them better and they won't do it. I think that CBT goes hand in hand with the antidepressants. And the brilliant thing about CBT, like you say, it's not like years and years of psychotherapy, but you need to plug in every couple of months, so that, because I think it really helps with anxiety, because when the anxiety gets too piles up, then that's when the depression comes in. And when you're going to CBT, when you're taking all the inventory and you're doing all of that, your mind is much clearer, and you've let it go too long. So now you've got into your head that it's something you really have to prepare yourself and really go to. You'll never, if you can't say today you're going to go, there's nothing going to change in a little while. So tell me, what a CBT, what do you think? I definitely noticed a difference. What do you think it's done for you and the CBT
When it's
thing?
working, and when I go back and when I'm back in there and I'm seeing her on a sort of slightly more frequent basis, where it works really well and where I use it in most situations is if a negative feeling, which is usually the source of anxiety or depression, comes into your head, the thing that they encourage you to do, and I remember sort of striking upon this analogy with my therapist, was you kind of throw up a pop-up court of law in your head. So if you have a negative thought about something, or you're projecting into a situation that this is going to end, or I'm not going to be very good at this, or something starts to overwhelm you with negative feelings. And I say negative feelings rather than depression, because it could be jealousy, it could be rage, it could be just crushing low self-esteem. The process encourages you to write down what that negative thought is and weigh up all the literally factual pieces of evidence that support it, and perhaps the outcome of what you're fearing, and all those other pieces of evidence that push against it, that contradict it and suggest that it won't happen. And I found that no sooner do you do that, it's the very act of doing that, what that process allows you to do, it gives you a framework to apply to every single scenario you encounter. Certainly for me, and I'm not necessarily espousing all of the correct details. I'm not using the right phraseology, terminology. I'm sure that it's far more nuanced than this. But the sort of, the broadest brushstrokes that work for me are that I will basically act as attorney for defence and prosecution on a thought, fear, anxiety, or moment of depression. And in that process, more often than not, 95% of the time, you uncover that it's all based upon irrational fears, low self-esteem, an inability to be kind to oneself, be kind to others. And
It's like it puts a spotlight
yeah,
on something that's sort of in the mud.
yeah.
That you know in your heart of hearts somewhere that's the truth, but you can't see it.
And it's that thing, I do think
It's
this
really
is a
clever.
key
It's really simple.
yeah, and I think a key part of anxiety / depression / alcoholism is the idea that whatever it is that's driving you down, you're kind of willfully taking yourself there, but you're looking at really sort of jaundiced and incorrect evidence to get there, because actually you want to get the familiarity of feeling shit is where you're heading to. In that spiral towards that negative space, CBT, the way I use CBT and the way I understand it, I immediately, as I say, throw up a pop-up court and I go, right, pop the negative thought in the dock and let's interrogate it from the prosecution.
It's a good way to explain it.
And for me, it really works really well. It's worked really well in terms of working out my fears of abandonment within a relationship, which can then feed into jealousy and all those things. It's worked with not feeling that there's an uncontrollability to situations which I perhaps feel nervous about.
It's really, really useful. It moves you on. It's not like a lot of therapies where it takes you back and digs up all the old pain and dirt of stuff and then sort of shoves you out the door and you don't know where to put it or what to do with yourself. You leave there thinking, okay, right, okay, I know how I'm going to wake up tomorrow and what I'm going to do. And so, yeah, it's definitely, I would definitely recommend it in lots of different situations. And as you say, it really helped our Kiki with her anxiety.
It's helped us in our relationship, I think, subsequent to couples counselling. I think it really has. I had another epiphany about alcoholism as well the other day I thought I'd share. And this is going to be, it's not meant to sound like, whoa, on I special, but I remember drinking for an awful lot of my life because I was really, really bored with the company and the conversation I was having.
No, well, I can think of that where I've just stayed drinking because...
Do you get that?
Because it gets to the point where I think, oh, God, I'm bored and I want to go home.
Yeah.
But everyone's like, oh, God, the party
It's just
goes
starting.
on.
Yeah,
So then you think, oh, right, okay, well, I have 3 really fast drinks so that I'm quite pissed and then I'll be at the same state. And I think that's the same for so many people. And the thing is, just go home.
Yeah.
Can you just say to me, because people ask me this all the time, how it is for you as an alcoholic having somebody that drinks? Somebody tweeted me yesterday and said, how is it for Mark when you drink the very thing that is his demon.
I want to kill her because she can have as much as she wants, but she doesn't. I mean, she literally doesn't. It drives me nuts. I see these glasses sort of, with a little bit of Bailey's in, and I go, what's wrong with you? What is wrong with you? Drink it all. Drink it all. Drain it. Get the bottle. Swig it back.
Don't listen to
buy
him.
Another
Listening
bottle.
to him gets everyone in trouble. Do not listen to him.
No, I mean, living it. I tell you what, I'm so grateful for how you are around drink. You're very considerate, and with your consideration, I think the least I can do is be utterly comfortable and benign about you having a drink. You don't drink in an aggressive way. You don't drink in a needy way. I'd have thought you've encountered this problem too. I mean, one of the problems I had, a real motivator for drinking more and more, and I know we're bouncing between drinking and depression, but it's what it's about, isn't it? Is the fact that I felt a huge burden of responsibility to live up to the narrative that most people I was going out to drink with thought was going to happen that night. I was the engine for the evening. I was the thing that was taking things on. I was the craziest. I was the one that, where will we end up? Go out with Mark. He's so, I'd literally be chucking my card around all the time. And I think
Credit card.
Yeah, and I think I was doing.
Why? Why did you do that?
I think I was doing that because I thought this was what popularity was. I was doing this because I
remember
thought
those nights when you were like that.
Yeah, I thought, oh, this is I'm not that I was thinking I'm buying friendship, but I think again, low self-esteem. You think, why would anyone actually want to be my friend for me?
You silly sod.
Well, no, but
Honest
but
to
you
God.
think it, and I think it's as simple as you end up getting to a point where you're habitually trying to keep everyone entertained so they don't get bored.
And
So
yet
they won't go
And
away.
yet they were all right, and everybody always loves
Well, they
you.
were
It's
not
crazy.
only all right, they all had a bloody. I never got a bloody drink bought for me once.
Not even now does anyone
I don't
buy
even
you a
get
drink. And you
I'm the
drink Diet Coke.
cheapest date, and no
Nobody
one ever
buys
buys me a drink.
You know why? Because people are awkward. They don't know what to ask you. That's why it's awkward to buy an alcoholic
That drives me
drink.
nuts. If I'm not fucking awkward with you drinking, don't be awkward with me not drinking. That drives me nuts.
Which nuts?
These nuts.
Is that driving you nuts?
Yeah, man walks into a pub with a steering wheel attached to his crutch. Barman says, "What's that for?" He goes, "I don't know. It's driving me nuts."
But boom.
It's very good.
He's funny. He's got a future.